I hear that you are having a few symptoms that are really bothering you, right? Yeah. Would you mind just telling me a little bit about that? I have down here that you're experiencing some nausea, some upset stomach, some stomach pain. Okay, I'm just going to take a few notes down while you elaborate a little. Okay. Okay. All right. On a scale from 1 to 10, with 1 being not bothering you at all, no pain whatsoever, and 10 being the worst pain you've ever experienced, the most disruption in your life, how would you rank these symptoms? Okay, so more unpleasant than anything, and have these been affecting your day-to-day life, your errands, being able to do your household work, your job, anything like that? Okay, so you've kind of been toughing it out. All right, that's good to know. So I'd like to ask just a couple of quick questions before we get into it. Firstly, do you have any medications you're on? Any supplements? Anything of the sort? Even just taking something like ibuprofen or acetaminophen? Okay. There we go. Okay. And any allergies you're aware of, or food intolerances even? And any other health conditions, things like asthma or diabetes, anything like that? Okay, good to know. I want to just get a few vital signs from you, and we're going to be doing a bit of exploring today. We're going to see if there's anything very obvious that might be causing your symptoms or contributing to them. But we're going to start by seeing if maybe there's any sort of illness present. So I want to just get out my little temporal thermometer here. So turn that on and then mute the beeping. That's not very pleasant. I'm going to have you just sit still for me. I'm going to come right here and just sweep that over the forehead. Okay, so about 98.4, well within normal limits. 98.4 degrees Fahrenheit. Now, I'd like to take your heart rate. So what I'm going to have you do, you could just roll up your sleeve, and I'm going to take 2 fingers here and put them right below the crease of the wrist, along the radial artery, and we're going to measure your heart rate. So, if I could just see right there. Okay. 1, 2, 6, 7, 8. 15 seconds, 24. 15 seconds, that's quite high. 96. 96. So that is still within our normal limits, just barely. Our top limit would be 100. Are you experiencing any sort of nervousness with this appointment? Of course, that makes sense. Yeah, you're not feeling well. You just want to know what's going on. Okay. Well, we'll just keep that in mind, and the next time we see you, we hope that that'll be a lot lower. So, blood pressure. We get our sphygmomanometer right here. We're going to do a little bit of finagling. A little bit of finagling. So I need to grab the stethoscope. I'm just going to place this in first. And then if I could see this arm. Okay. If I could have you just slip that into the cuff here. Okay, let's get that nice and tight. I am going to put the dial, it has a little clip at the back. We're going to put that on the cuff. Make sure that the valve is closed on the cuff, and it is right there. I'm going to put the diaphragm of my stethoscope, the crook of your elbow, and I'm just going to have you relax the arm. Just relax. This isn't the most comfortable test, but it is quite quick. You ready? Okay. We're going to go nice and gentle here. Just letting the cuff inflate. Until we don't hear the pulse anymore. Pressure's there, and I just want to grab that one more time. Often get a little bit of a more accurate reading the second time around. Just take this time to take a breath, relax a little. Right there, let the pressure out a bit. And 80, okay. There we are. So, let's unfinagle a bit. Just going to take off the dial here. And if you want to slip your arm out of the cuff, there we go. And this can go back on me. So 120 over 80 millimeters of mercury. Last thing is very easy, very simple. I have a little clip here, and I just like to put this on your finger so we can measure the oxygen saturation rate. So, if you could just show me your finger, and then we'll clip that on. We'll just hold that on there for a few moments. So, even though you are experiencing issues with your GI system primarily, while you're here, I just want to investigate around. We'll look a little bit everywhere else as well. You never know if you can find something that might point you in the right direction. Let me just grab that meter. Okay. Percent, so that is also well within normal limits. So I'd like to start by taking a look at your ears. We're just going to take a little peek inside the ears and see if we can find any related things that might tell us what's going on, since nausea, upset stomach, all that. That's pretty vague and non-specific. It can be caused by a lot of things. So, if I could just have you just stay real still for me. There we are. So, with the ears, we could see maybe there's anything odd going on that might contribute to your stomach not feeling well. It's not likely a cause, but there might be little signs of something that is contributing. Are you experiencing any pain or tenderness here? Okay, good. Very good. I want to make sure that we're not hurting you or making anything worse. There we are. Okay. So no drainage here. Everything looks pretty good. No irritation or anything like that. Come back out with that, and we'll look at the other side. And then take a little look over here. There we are. So right now, things like allergies are not going to be nearly as applicable unless you have maybe mold in the house. Seasonal allergies, I mean. Certainly food allergies or other things like that could be on the table. And it doesn't look like you have any sort of ear infection, which could also contribute to a general malaise, not feeling well. But ears look great. Tympanic membrane, the canals, everything looks great. So I don't think that is a contributor to what we have going on. But I do want to check on your sinuses and your lymph nodes. Your lymph nodes can tell us if you're fighting something off or have recently. Your sinuses can tell us if you have anything going on with that, which can also contribute to not feeling very well. So I'm going to be pressing and tapping along this area here. This area, and along the nose, right in here. I'm going to start right right in here. I'm just going to very gently press and tap along this area. So we're going to press, release, press, release, press, release. Is that uncomfortable or tender at all? Okay. And if I were to tap, 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 how was that? Mm-hmm. Okay. Let's get right in the ethmoid sinuses. So we depress, release. On either side of your nose here. Anything there? Just like that. Oh, good. Good, okay. Okay, so sinuses look to be in good shape. Now I'm just going to do a little bit of palpation here behind the ears and in front of the ears. Under the jaw. And down each side of the neck here. And right down in here. Good. Okay. So, why don't we take a little look at your eyes? So, I've noticed that your eyes do have a bit of redness to them. I want to just take a little closer look and see if that is just from being irritated. There's a lot of dry air, dust getting moved around a bit by moving air. Okay, can you just look straight right here? Okay, I'm going to pull down this eyelid here. Good, the other side. Good, and just keep looking right here. Pull up. Okay, the other side. Good, so that's not very irritated. It might just be the sclera here. So let me grab a light. This is going to be quite bright. I want to start by just putting the light underneath your eyes so that the pupils don't react as much. And just look at each eye with that little bit of light. Good. Keep looking right here. Okay, would you mind looking right over here? And if you could look right over here. Good. Up here. And down here. Let's see if I can do. There we are. Just keep looking down here. Good. Okay. Come back to looking right here. And I am going to shine the light directly in the eye so we can assess the pupillary response. Pupils should be equal, round and reactive to the light. Good. Are you experiencing any strain or fatigue with any of this? Good, okay. Do you happen to use eye drops at all? Okay, that might be something to think about, especially with how dry things are getting. You don't have a humidifier or the old-fashioned putting foil pans on the floor vents with water. Good. And if your eyes get more irritated with the eye drops, then you could think about one with a preservative-free formula, which is going to be much more gentle, non-irritating. And do that once in the morning and once in the evening. Okay, excellent. So, I'm really curious about your nose, mouth, throat situation. So, when we've talked about your symptoms, you haven't mentioned anything about experiencing heartburn or acid reflux, right? Okay, not quite sure there. So, do you also experience an itching or burning sensation in the ears, the nose, a sort of burning in the throat at all? Okay, no, alrighty. So we probably, if this is an acid reflux issue, probably hasn't gotten to the point where you can feel it up here, which is good. That's not fun at all. So let's get the otoscope, take off the speculum so that I can funnel the light into the nasal passages much easier. I'm going to have you tip your head back, please. Thank you. And we're going to get a little peek inside the nose. Do you have any trouble with breathing, snoring, postnasal drip at all? That'd be a runny nose. Okay. Have you been experiencing any drainage at all in the throat, feeling something running down the back of your throat? A little bit, okay. Well, that might be something that we look into as well, because if you have quite a bit of drainage going into the stomach, that's going to make your stomach feel quite upset. Let's take a peek at the mouth, the throat, with our tongue depressor and my brighter light. So if I could have you just open your mouth and I'm going to look at the teeth first, as well as the buccal mucosa. See if there's anything here, any irritants. We haven't had anything with the lymph nodes, but sometimes if you get an infection, some people get sores on the top of their mouth, on the roof of the mouth, not quite back to the hard palate area, but just right in here. Good. Can you lift your tongue to the roof of your mouth? There we are. Excellent. Now that looks great. And can you stick out your tongue as far as it'll go? Okay, so let's just keep that down. And let's do a little look-see inside. Okay, so the throat wall is non-irritated and no cobblestoning. So likely we're not having acid into high up into the throat, which is good. And do you have your tonsils out by any chance? Okay. Alrighty. Well, it's all clear. The tissue is smooth, correct color. Could you say ah for me? There we go. Good. Now, while we're here, I also want to look at the neck. I'm going to start with a touch of auscultation. And we're just going to pop this in. And I'm going to listen to your carotid arteries. And that'll tell me if it's safe to palpate around there. So I'm going to have you take a deep breath in. And just hold that breath. That way I won't hear the rush of air in the throat. Good, and exhale. Sigh, deep breath in. And hold. Wonderful. And exhale. That is indeed telling me it's safe that we can palpate around there. So what I'm listening for is called a bruit or an audible heart murmur. And if I were to hear anything abnormal, I don't want to palpate in this area and disturb anything. So just going to feel, so the trachea here, midline. Yep. And we've gotten to our lymph nodes. And I'm going to have you swallow while I just palpate around the thyroid here. If I could have you take a dry swallow. There we are. Good. Okay. Now I'm just going to palpate the carotid arteries. Sit here for a few moments. Mostly looking for quality and strength. Although it does feel like the heart rate has come down a little bit, so that's good. Oh, just keep right here. We'll just feel that other side. Good. Let's go ahead and take a little listen to the chest. I'm going to have you take a deep breath in and out. So, inhale, exhale, Exhale. Inhale. Exhale. Very good. Inhale. Getting great lung sounds here. Inhale. Exhale. Last row here. Inhale. Exhale. Inhale. Exhale. There we are. Let's take a listen to the valves of the heart. Don't need to do any special breathing at all. Good. Low aortic valve. Pulmonary valve. Tricuspid valve. Mitral valve. Good. I'm just going to reach behind you and I'm going to have you take a deep breath in and out. Deep breath in and out. Deep breath in and out. Last one. Deep breath in. Good. So, while I have the stethoscope in, I'm going to listen to the abdomen now. And this is where we're going to spend a little bit of time. So, I'm just going to have you breathe normally here. We're going to check in with our digestive sounds. Feel around the organs a bit. Let's see if we can get any more clues as to what has been ailing you. So far, our digestive noises are normal. Just working around each of our quadrants. So, are you currently experiencing that nausea feeling or the pain in your abdomen? Okay, so I'm going to warn you ahead of time. I'm going to be doing some palpation that has both a firm pressure and then there will be a deep pressure. So this might jostle things around a little bit. Let me know if you feel like it's too much and you need a moment. But we are going to start right over here, and I'm going to use one hand to start. And the firm pressure might just more jostle things around a little bit. Are you having any areas of pain or tenderness here? Just sort of an all-around soreness. Okay. Alrighty, so now I'm going to use two hands and a deep pressure. Now this one, I'm going to guide you through this using your breath so that I don't punch the air out of you accidentally. And then we can go a little more at your pace. So we're going to take a deep breath deep breath in and out. Deep breath in and out. Getting each quadrant with each breath. Last breath. Deep breath in. I want to feel a couple specific places while we're here. We're going to start with the spleen by the stomach area. It's a little more up into the rib cage, but we're looking for enlarged organs. Okay, and the liver. This one's a nice big guy. Normally, so it's pretty obvious if it's a little too big. Okay, and we'll check the kidneys. So again, this is going to be quite firm. Have you take a deep breath in and out. Bilaterally feeling where. Okay. All right. So I'll give you a second. Let everything settle down a little bit. And while we do that, I'm just going to take some notes down. Irritate. Irritation. Lastly, I'm going to do something that should not jostle very much. I'm going to do a bit of percussion on the abdomen. I'm going to move my hand around the abdomen and tap on my finger, and we're going to listen for the sounds that come back. Doing that, we can tell where there's areas of fluid, where there's areas that are hollow. We can make sure that everything is where it should be. We can map borders of organs that way. It's quite a useful tool. So you don't need to do anything special. Just do your best to stay as comfortable as possible. This is pretty quick. There's our liver border. Good. Okay. So, in terms of the abdomen, we had just that all over soreness. But in terms of auscultation, sounds great. Palpation's great. Percussion's great. While we're here, I just want to, real quick, check your knee-jerk reflex. So if I can have you relax the legs, just relax them down. Okay. And I'm going to do a couple taps here. Oh, that's not a good one. There we go. Got some good jerks out of that. There we are. And would you mind if I just take a look at your hands? Ah, yes, quite dry skin, huh? We've been dealing with a lot of hangnails recently. Yeah, I feel like I loosen my hands so much, but it just doesn't seem to matter. But I'm someone who has to wash their hands quite a bit. You're always playing catch up. Okay, capillary refill looks great. Hands are dry, warm. Colors look good. Let's take a look at the legs. Just really quickly. And the feet. You don't have any abnormal rashes, spots, anything different, even something like an area of the skin that has gotten quite hot, no swelling. Okay, good. Yeah, that looks good. So, this little examination of ours was more for information gathering, so I have some good news and I have some frustrating news about that. The frustrating news is that I don't think we want to do any sort of prescribing anything or even necessarily referring out just yet, because I've got a bit of a master list of things we can try to address the nausea before we go up the ladder. So, the very first thing I'm going to have you do is, for the next week, I'm going to have you create a symptom diary in which you say when symptoms occur, what all the symptoms are, describe them if you can, see if there were any triggers. For example, maybe you just got done eating, maybe you just got done doing errands. And we're also going to record anything that possibly relieves the symptoms. So, the unfortunate thing about nausea, general abdominal pain, upset stomach, it's very vague. There are so many things that cause that. We have things like food intolerances, allergies, stress, illness, even sensory sensations. We have migraine, different types of medicine, and acid reflux. It's a very long and expansive list. So we want to narrow this down so we know how to approach it. I have a little list of things that we're going to try. So even though I'm not going to prescribe you anything, I'm going to give you a gigantic list of things. And there should be at least one thing that helps even just the littlest bit. The very first thing. No restrictive clothing, especially over the abdomen. What this means is you're not going to want to wear a belt. You're not going to want to have tight elastic bands. You don't want anything that pushes on the abdomen, especially if this is an acid reflux thing, which can push the acid up into the esophagus. And that's just going to make you feel better anyway. We're going to see if cold or hot sensations help at all. In terms of migraine, many people feel relief with nausea with a cold pack or just relief in general. And there's also this sort of thing where if you've ever been very ill and you're lying on the bathroom floor and it's very cold, it helps you feel a little bit better. That's because that sensation is distracting the nervous system a little, so it doesn't have just the nausea to focus on, but it also has the cold. Some people that doesn't work, but hot sensation might, like a hot water bottle placed over the abdomen, maybe more around the stomach, more around the intestines. That might be helpful for you. But that's something we want to try out. Another thing is movement. If we're experiencing acid reflux or indigestion, sometimes the best thing is to take a walk after eating because it settles everything down. But for some people that makes it much worse. So we need to know, does movement make it better? Does it make it worse? We want to be careful about our food. We want to see, do the symptoms get better or worse with food? What kinds of food? I would recommend that we're going to eat smaller, more frequent meals. Instead of giving your stomach one big meal to digest a few times a day, we're going to do smaller bits more times so that it has less to work on. And we're going to want to restrict drinking any liquid while eating as well. So maybe about a half hour before and after eating, not drinking any liquids. That might help a bit. And if we can, stick to blander meals. This would be like chicken noodle soup or chicken broth, or vegetable broth, bone broth. This would be like oatmeal, eggs, maybe cereal. Depends on if your body doesn't react to milk. Some people, that makes people a lot more ill. We definitely want to stay away from things like tomatoes, peppers. Chocolate is going to be pretty heavy. Cheese can be quite heavy. Too much pasta, again, very heavy. Things like toast, pretty great. And we want to look at what water does to your symptoms. So, we want to stay hydrated, but we want to see, does drinking water make everything worse? Does it make it splash up? Does cold water make it feel worse? Oftentimes, I will have people swish the water that they're drinking in their mouth to get it to a lukewarm temperature before they swallow, so it doesn't shock the stomach and make it feel thicker. And if we're dealing with acid reflux, we might want to try sleeping in a reclined position as opposed to lying down, where the acid can easily travel up into the esophagus. So that might be something. I find that even just sleeping reclined in general, when one is nauseated, that can be quite helpful. Lastly, we do have some simple remedies and some medicine options. In terms of simple remedies, we have peppermint with a caveat. if we're dealing with acid reflux, peppermint is going to make it worse because it relaxes the esophagus and allows acid to travel up into the esophagus more easy. So that's going to be something we will determine a little bit with some trial and error. So there's options like peppermint tea, gum, candy, even smelling peppermint oil is used quite often for nausea. Ginger is another one. Candy, ginger ale, tea, gum. This is often used by pregnant people. Use ginger quite a bit to ease nausea symptoms. We have menthol / eucalyptus. This is particularly my go-to. You could try a cough lozenge, one of those menthol ones, to see if that helps. Or what I like to do is get vaporizing rub and just smell it from time to time. That seems to ease my nausea symptoms a lot easier. And the last one is a little more anecdotal. It seems to work better for some people, not so much for others. And this is isopropyl alcohol. For me, if I smell isopropyl alcohol, my nausea completely vanishes for about 4 to 5 seconds, and then it slowly creeps back in. Some people, that clears it up very quickly, lasts a lot longer. So if you have isopropyl alcohol at home, that might be something that you take a little sniff of. We don't want to huff it. We want to make sure we're still getting fresh air. But that might be something that's quite effective for it. Lastly, in terms of medicine, we have a few options. So if we are dealing with acid reflux, we have things like Tums or Rolaids. I find for general stomach upset, they don't work very well. Rolaids may be a bit more because they can be a little minty. And Tums does also seem to work a little bit for indigestion or overeating. And then if we do determine this is acid reflux, we can go with something like a famotidine, for example, which is marketed, I believe that's a Zantac or a Pepcid. But if we have just general nausea, general indigestion, GI symptoms, then our go-to is going to be Pepto-Bismol. And I would highly recommend not going with generic. I've found that generic, either the liquid or the pills, the tablets, all of them make the symptoms worse, anecdotally. It might not for you, but if you can, I would spring for the name brand. They have it in tabs and liquid. Personally, I always like the little tablets because you can take those anywhere. Very easy, and it doesn't have that slimy coating in your throat. But that's also a good option to try. So, for a week, you are going to record your symptoms and record any possible types of relief. So I can print all this out for you because it's a big list of things. And I'd like to see you back within a week. Okay? Alright. Do you have any questions at all? I know that's quite a bit of things to mull on. Yeah, so in the subsequent appointment, that is where we are going to look at the symptoms and determine, do we need to prescribe a medicine for the nausea? Do we need to refer out to gastroenterology, for example? So that's where we would be taking action. This is our information gathering exam. The next one will be where we really figure out what path we want to take. Okay. All right. Well, I hope that you are able to easily find something that helps relieves these symptoms. And until then, I hope you have a whale of a day and a good rest of your night. Thank you.